Well, June is Men's Health Month, and studies show that 40% of men only see a doctor when they are experiencing a serious health issue. So to help men understand what they should keep an eye on to catch any issues before they become serious, I'm here in studio now with Dr. Nita Bijoor from Oakview Medical Associates. So thank you for being here. And
You're welcome.
We were actually talking over the weekend. You have a very fun way, a fun acronym to help remember the top 5 health numbers that men must watch, and it is WATCH, W-A-T-C-H. So let's go through them right now.
Absolutely. I tell all my men to watch these numbers. So W is the waistline, which is a predictor of obesity, which indirectly affects heart disease, stroke, and all the other diseases that we see. So the waist must be under 40 inches.
Which is interesting because I feel like many men in my life think 42 is kind of good, but that would be over what that
would be over because it predicts abdominal obesity. Yes.
Yeah. And what's the concern there if you're over that?
So if you're over that, there's an increased risk of high blood pressure, increased risk of type 2 diabetes, increased risk of low testosterone, erectile dysfunction, obstructive sleep apnea is all linked to your metabolic decline because of a higher waist circumference.
And is it true? I've always heard that, if you're really anyone maintaining a lot of weight around the waistline, then that could increase you're more likely to have a heart attack. Is that a true indicator?
Yes,
okay,
absolutely.
Just wanted to make sure that was legitimate because I'd always heard that. Also, let's go on to the A. So the A, the A1C.
Yes, know your diabetic number. 1 in 7 men have type 2 diabetes, and about 33% of men have pre-diabetes, so that's pretty high. Diabetes, again, is linked to heart disease and stroke and dementia and a lot of other complications.
And then T, the one that we talked about at length last week, testosterone. That's a big one.
Yes, that's a big one. Everyone wants to know about their testosterone. Now, it must be at least 300 to 800 in range. And it's not just about the numbers with that. It's the symptoms, lack of motivation, mood, loss of libido, just loss of endurance, bone strength, muscle strength, all of those, you must get the level tested. And about 20% of men over 60 have a low testosterone. About 40% of people with obesity have a low testosterone, so that's really important.
Yeah, and that's something that you can get treated too. That's exactly what we
100%,
spoke about last week too. So don't wait until those symptoms get overwhelming.
That's right.
Until you go, that's a good sign with many men. I know I have that conversation with my husband. Don't wait until things are overwhelming and you feel terrible. And then C, this one very, very important too. What is C?
So know your cholesterol, especially the LDL, the low density lipoprotein cholesterol. Across the board must be under 100. But if you have high risk like high blood pressure, diabetes, then the goal is at least under 70. Because that again is the strongest predictor of heart attack and stroke.
And what can people do, men or women really, how should we be eating? Any big adjustments that we could do at home that will help us with cholesterol?
So lifestyle comes first. Nutrition, really paying attention to low-fat, healthy diets like high-protein diets, just keeping it as much plant-based as you can. High fiber is a big predictor of lowering your cholesterol. So a lot of good tips there to lower the LDL.
And then finally, the H there, hypertension. What should we know about that?
So H is the most important one. It is a silent killer, hypertension or high blood pressure. The blood pressure must be under 120/80. And 1 in 2 men have high blood pressure. And they wouldn't know it unless you have it tested at the doctor's office or a clinic. So
yeah, and I know we don't have much time left, but that was the last thing too. How often should men be going to the doctor, even if you think you're perfectly healthy?
At least once a year. That's called an annual physical. But men know all the stock numbers, their favorite team sport numbers, but then they don't know these simple numbers that could keep them healthy and live long so that they can take care of their families.
So know your score, gentlemen.
That's right.
See how your scores go in there.
That's my watch.
Your batting average, very important. All right, thanks again, Dr. Bijoor.
You're welcome. Thank you.